Should every breast cancer patient receive aggressive chemotherapy, even if just one node is active and the tumor is not a particularly bad behaving tumor? Not necessarily. A solution is on its way. IBRIS, or Image-Based Risk Scoring System. There has been a dramatic increase in breast cancer incidence over the last decade, which has led to an increased demand for predictive and prognostic companion diagnostic assays to ascertain the aggressiveness of cancer phenotypes so that patients with less aggressive biology can be spared chemotherapy. Dr. Anand Madhabhushi from Case Western Reserve University, Cleveland, US, Mark Lloyd of Inspirata Incorporated from Florida, Dr. Vani Parmar, Dr. Anita Desai, and Dr. Vidya Rao from Tata Memorial Hospital, Mumbai, as well as Dr. Hannah Gilmore and Hoijay, again from the United States, bring you the story of collaboration that has the potential to revolutionize the way breast cancer is treated today.
One of the big challenges in the management of early stage breast cancers is that the majority of women with early stage estrogen receptor positive breast cancer don't actually need chemotherapy.
Even if there is just one active node of cancer, the patient normally goes through aggressive chemotherapy with attendant falling blood counts, cardiac side effects, failing cognition, and neuropathy, besides hair loss. All of this could almost be turned on its head if the diagnostic algorithm called IBRIS, or Image-Based Risk Scoring, is applied on the standard whole slide stained tissue specimen before deciding the course of treatment.
And so the real goal here is to essentially develop and deploy machine-based algorithms for interrogation of pathology images for women with breast cancer.
It is all hidden in that image. It is the secret in the image that we are deciphering and bringing it out by using a software to actually bring it out.
Developed by Dr. Anand Madhabhushi at Case Western Reserve University, IBRIS is completely non-destructive to the tissue. Since it is a digital test, it only needs an image of a slide, and the machine learning algorithms are able to interrogate that image and provide a score to the oncologist as to whether a patient would need chemotherapy or not. A quick look into the image-based risk score begins with scanning this tissue specimen on slide. Selecting the area of interest in one of the tumors from a patient, each image here is being pixelated and converted into digital files on which artificial intelligence would be used. Digitization, allowing 80 times magnification, makes this digital hand clearly indicate the boundary of this tumor, something not normally achievable with routine microscopy. What's more, IBRIS clearly establishes the variations, for instance, in size of these bean-shaped nuclei, which have picked up stains in a different manner, making it look darker. IBRIS in fact measures a certain layout of the nucleus, the distances between cells, as well as providing clear enough indicators about how the body is responding to the invading cancer through the look and ratio of the tissue surrounding the cells. Looking at these and a score of other physical expressions of the tumors, IBRIS offers clinicians an understanding about whether there is a pattern that is evolving from the arrangements of the cells, which could be correlated to understand disease recurrence or disease progression.
There are many things that I can see underneath the microscope when I diagnose a breast cancer, but there are many other patterns that the human eye can't see. And what IBRIS really is an algorithm, taking all the tremendous amount of information in the glass slide that I can't see, but transform that information into something that's really useful to be able to predict disease, predict response to therapies, and predict prognosis for patients.
What we are doing now is actually testing the same IBRIS software that has been developed over a set of patients from US, where it has been tested, and that is now being tested with the Indian set of patients.
Not only differentiating a malignant tumor from a benign one, IBRIS also indicates whether the whole tumor or just a part of it will respond to treatment, and if it is a bad tumor, how difficult the treatment would be.
There is constant quest to look for low-cost alternatives or low-cost options to this expensive molecular testing, and one of the strategies now we are thinking of is whole slide imaging combined with artificial intelligence tool.
This is groundbreaking in that it's a low-cost assay that's available with the 67 cents to make glass slide that is the standard of care throughout the globe, and to be able to use that information very specifically to design therapies that ultimately cost tens if not hundreds of thousands of dollars in the most efficient and effective way possible.
IBRIS will help in designing a personalized, more appropriate and a lot less painful therapy for a large number of breast cancer patients all over the globe.